Bonsoir, bienvenue pour suivre nos programmes News Extra pour ce mardi soir. Tantôt, nous prenons 3 sujets. D'abord, semaine passée, un groupe docteur CNES, il participe d'une session la maladie rognon. Sa session qui tient inclut plusieurs présentations par un spécialiste de sa domaine, qui parmi une activité pour commémorer la journée rognon. Sa activité tient pour sensibiliser les autres la situation maladie rognon ici c'est celle-là.
10 years before, it was established that CKD was the 8th leading cause of non-communicable chronic disease. But in last 10 years, it has progressed to 4th position. So now CKD in the world is the 4th prevalent cause of non-communicable chronic disease, which affecting the morbidity and mortality worldwide. Those patients who have hypertension, who have diabetes, and especially those who have a family history of CKD. So those patients should be assessed early. And how they can be assessed? They can be assessed by running a proper and efficient screening programs, so that once they can be screened out, they can be put on a label to diagnose them, and then after diagnosis we can offer them a proper treatment. Once the patient are screened, they can be put on these levels that which patients they need to be more vigilant, followed up, and they have to be treated on at an earliest. So the red markers, they show the severity of disease. Kidneys are one of the more ignorant organs in our human body, and although I can say that kidneys are more innocent organs, because they cannot say anything. If your heart disturbs, it make you angina. If your brain disturbs, it make you stroke. But kidneys, they usually don't say you anything until unless they reach on their final level. So once they tire, they say, okay, now it's out of my control and I cannot do it. So it's very important. And kidneys are the last organ in your human body which maintains all your hemostasis.
Sa session ça dit il peut gagner faire en commémoration World Kidney Day qui ti semaine passée. En effet, la session est intéressante pour il target un petit peu cause un petit peu qui nous quantité de monde qui peut faire face avec problème royaume maladie royaume c'est celle qui ban la tisane qui les autres gagne affecté et qui façon qui comme un bon professionnel médical nous capable faire façon prescrire ban la tisane de façon un peu plus safe pour ça ban di monde capable servir et aussi pour nous discuter un petit peu de nouvelles façons pour nous capables améliorer nous l'approche et surtout nous cause beaucoup qui bonne façon qui nous vivre à cause avant la tisane il mort qui nous peut vivre dans nos vie tous les jours qui nous peut manger qui nous peut boire qui nous peut faire qui en a sa plus grande importance.
Mais on va pour aider personnellement.
Personnellement, comme un docteur, il aide beaucoup à cause de mon gars, discuter avec mon bon collègue de quelle façon que nous pouvons plus bien manager bon client, bon patient qui a un problème royaume, qui la pose nous peut prendre de différentes circonstances, nous peut prescrire bon tisane et qui bon advice qui nous peut donner bon du monde, il fait nous plus conscient qui c'est celle nous bon niveau bon patient qui a un problème royaume, il est vraiment haut, il y a la main et des fois il y a wake up call pour nous faire beaucoup plus d'efforts pour nous capables tackler ça et réduire ça ban norme et ban patient qui already est affecté et faire si qu'il nous peut prescrire soit nous peut faire ban approche nous faire de façon qui safe.
After the age of 40 years, 1 ml per minute per 1.73 meter square, the GFR drops every year on year. It is acceptable if it is increased up to 2. Anything more than 2 ml is not good. So here we'll see with this patient what happens is baseline was okay. Baseline drop is started in the top line. Then he had an episode of gout and he was given NSAIDs. So he had one dip. Then he had an UTI, then they gave aminoglycoside, gentamicin. He had another dip. Then he had some chest pain, they did a coronary angiogram. Again contrast, one more dip. Then he developed congestive cardiac failure, they gave diuretics and other medicines. So he ended up with CKD and is on dialysis. So this is how it will affect. So if you could prevent at initial stages, maybe you could have used some non opioid analgesics instead of NSAIDs. We could have used appropriate antibiotics, monitor the drug levels properly. We could use alternate methods of investigations instead of using a contrast procedure. So all this could have prevented his decline.
Totally, we having 220 patients in dialysis, including Prasley and Mae. Okay, this is the total percent. In Mae is 94.9%, and in Prasley 5.91. Total in Mae nowadays is 207, and in Prasley is 13 patients. Then every year increase the patient in our country. Then we need to think about what we are do, because I think so the work is need to be together, not only for the nephrologist side. Everyone need to involve to try to do the best for our patient. Okay, this is a very important topic, because this is the most important we can do together to try at least to control the people not develop in the future chronic kidney disease. Is the diabetic mellitus, hypertension, autoimmune disease, systemic infection is very frequent in our patient, exposed to drugs associated with acute decline in the kidney function. Already Dr. Kumar spoke a lot about this. Recovering from acute kidney failure, sometimes the people who recover was on acute kidney failure, but then after that recovery, we need to be tracing these people, to follow these people.
On the event of World Kidney Day, we are conducting a lot of awareness programs, and this is one of them where we wanted to target the community doctors and nurses who are here to sensitize them about the burden of kidney disease that we already have, and also to educate them how we can prevent and delay the progression of kidney disease, where the patients don't land up on dialysis all of a sudden, and they'll be properly managed, and then we have a planning schedule, and also we have a treatment protocol for them where they can be addressed at the community level rather than coming to the hospital and then do it. So it was mainly about creating awareness and sensitization to the doctors in the community, hospital, nurses, everywhere. Yeah.
How would you describe the session? Would you say that it was a successful session?
I was just talking to few of them, and they were all happy, and they were like, it's like a awakening. They said yes, this was happening, like yes, drug induced, like painkillers, Voltaren, Indocet, yes, these are happening, that induced kidney injuries, these are happening. So it's mainly to sensitize them and trying to bring them take notice of the situation that we are in right now. So I would say it was good, it was a success, and I hope people take away good points and implement in their practice.
How would you describe the kidney disease in Seychelles, like the amount of people affected? Would you say that it is alarming?
Definitely. For a small country like Seychelles, with about 100,000 population, we have an alarming rate of kidney disease. Close to 220 patients on dialysis, and we have a lot more who are waiting to enter into the pool. And this is a very significant number. Yes, one of the initial presenters showed the daily, DALI we call, disability adjusted life years. For Seychelles, it's about 500 to 1,000 days. When we compare in the international average, this is very high burden in Seychelles. So we have to stand up and take notice and try to implement some preventive measures so that we don't have a new epidemic of CKD, rather than we control and manage it in a reasonable way. First thing what you can do is know that you have a kidney problem. For that, what you have to do is to get tested, especially all elderly people. I mean to say anybody over the age of 40 years, annually do a blood test, do a urine test, get a blood pressure checked, get a blood sugar checked, so that you are aware what are your risk factors. And if you have risk factors, correct the risk factors, have a good lifestyle like exercise, drink at least 2 liters of water, 8 glasses of water we recommend, low sodium diet, whole grains. We are all into refined products. So try to eat more of whole grains, which is the traditional way of food for us nutrition. So and avoid painkillers and nephrotoxic medications. Keep your medications up to date. Achieve the targets, blood pressure targets, blood sugar targets, so that you can delay the inevitable kidney disease which can happen later on.
Most of the people in Seychelles that has kidney diseases, what other stage are they in?
Like there are all spectrums from stage 1 to stage 5. As I said, we have more than 220 patients on dialysis, which is the end stage. But earlier they will not know because they don't have symptoms, so they feel they are okay, they are fine. Unless they have symptoms, they will not go to the doctor. That is why screening is very important. Even though you don't have symptoms, it's better to get screened once a year just to see what is happening with your blood work, your kidneys, your liver, everything, so that things are under control.
La compagnie télécommunication Intelvision commence à servir son nouveau câble sous-marin qui appelle tout Africa, qui facilite connexion Internet, qui est 5 fois plus vite que tu peux offrir auparavant. Intelvision commence des masses pour sa câble depuis 2019, mais dit qu'il en a plusieurs états qui fait qu'il fait capable de commencer à servir sa câble salonnée. Avec sa connexion qui vient en mars aujourd'hui, Intelvision peut offrir de nouveaux services sans limite qui distillent vrais services sans limite de pays et expecter une connexion Internet qui est plus vite et plus stable.
There are 3 different type of packages. One is the cap package, one is the Infinite 899 and Infinite 1799. So watching on 4K is a breeze right now. As you see, this is working on a 4K content. Very crystal clear sound. This is basically YouTube. Intelvision, in collaboration with Vodafone, is pleased to announce today the activation of the 2 Africa submarine cable. With the activation of the 2 Africa submarine cable, we are also pleased to launch 2 new truly unlimited packages. These 2 packages are 2 packages of 20 MB and a 40 MB package. The differentiator of this package is actually, when I say truly unlimited, it does not contain any FUPs. There is no fair usage policy on any of these packages. That means there is no fair usage policy in the sense, usually people on a day-to-day basis when they use their internet, they keep worried how much of bandwidth they have consumed during the day. So with our new packages, there is no bandwidth consumption, which does not account to your daily quota. So they can watch YouTube, Netflix, whatever they want, then do streaming programs, then do online gaming, also do downloading. All of these type of things can be done without thinking how much you have consumed during the day. So these are 2 key features which we have launched today, which is available right now. Having said that, consumers buffering like YouTube, Netflix, none of this, all of this can be watched without a single problem. I would also like to take this opportunity today to thank all our existing customers who have been loyal to us the last few months, which we originally wanted to launch a few months ago, but it took some time due to the different variables which we had to encounter. So we would like to take this opportunity to thank them and for being with us all this time. And we hope many more people will come into our extraordinary package compared to an ordinary package which you have right now.
So I believe we started working about 2019 on this when initial discussions happened. We had several meetings abroad. We did some trips abroad to Singapore. We met up with Vodafone. We had some discussions. Plans finalized a lot more later than obviously after that. It took a bit of time to secure where the cable would be landing due to we had to take into account, we initially wanted the cable to land near the airport, but due to some constraints there, we had to find other locations for the cable to land. Eventually, the cable landed last year, April, and it was supposed to go live in September, but due to some small delays, it took some time to go online. But we're now ready, we're online, and we have all the necessary capacity that we need to service customers.
So it's the first time the cable is going online since you got it?
Yes.
Could you tell us a little bit about the benefits of the cable? Like you said, it's unlimited. If you could talk specifically on that.
So specifically, the cable goes to 2 locations at the moment. It currently terminates in Cape Town, South Africa, as well as Djibouti. The amount of capacity that we have on the cable, we've added 300 gigabits of capacity going towards Cape Town and 300 gigabits of capacity going towards Djibouti. This is added for redundancy and protection, so in the event of some form of fiber cut in the north, capacity to customers will not stop. They will be able to service. The amount of capacity that we have should be able to service customers for at least the next 10 to 15 years. So any form of upgrades that need to happen to be able to provide a good service to customers, we already have the necessary infrastructure in place to be able to cater for this.
And when it comes to the speed of the internet, can you talk a little bit about that? Will there be any interruptions if there's like other people using it at the same time?
No, the speeds are fast enough where multiple users can use the internet at the same time. We expect on the Infinity 899 package, people will be able to watch 2K content without buffering, and some 4K content, depending on the frames per second. And on the Infinity 1799, they should be able to watch 4K content at even 60 frames per second without buffering. The amount of speed available allows customers to have 2 or 3 people watching content at the same time without resulting in loss of quality as well. On the capped packages, we allow up to 100 megabits per second on certain packages. This will allow people to be able to download, have voice calls, and watch YouTube or Netflix or other content at the same time without experiencing any issues.
Is there any other company in the country offering a similar service via submarine cable?
Yes, there is. I believe Cable & Wireless and Airtel are offering it. However, we believe our service to be superior due to the fact of the amount of volume of capacity that we have and the additional redundancy that we've built into our network.
From today onwards, people can actually go ahead and subscribe to our services. And our existing customers, they already have the service. So they already have been experiencing this right now.
Yeah, so for our existing customers, during the test period, due to our customers, we value their loyalty. We've gave the benefit of the testing as well to the existing customers so they can experience the benefit as well. So although we're officially launching today, the customers have been experiencing the benefit for the last 2 weeks.
Okay. And any comments about it? How do they feel about it?
We've received a lot of positive comments. A lot of people are excited about the changes that are coming. There's some additional future improvements that we will be making within the next 1 week, which will help reduce latency. But so far, majority of the comments, or I would say all comments that we've received from customers so far are positive.
People tend to think that usually when it is new, okay, the bandwidth is good now, and once you get more customers on board, it will get weaker. In our case, it will not be that scenario because, as Frederick mentioned, we have up to 600 gigabits of bandwidth available. So say if we say we have 10,000 or even more customers, that will be more than sufficient for us to actually give all the speeds to all of these customers, which they require. And also I would like to mention that we are the only telecommunication provider in Seychelles to have its own submarine cable. So that itself is a very proud moment for us today.
You've said that customers you have gone positive feedbacks from customers. What about your workers? Are they enthusiastic with the new Intel Vision with the submarine cable?
Yes, they are actually very excited because, like I said, it's a new, very proud moment for us today because, as you say, everybody has been waiting for this for the last few months because we originally wanted to launch around September to around October, November, December, that period. So things have been very exciting for us the last few days. As you see, we have come up with a new campaign which is called Truly Unlimited. We are the only telecommunication provider today who can actually say that because there is no limitation. You can do whatever you want, whenever you want. There is no time because usually people think after 8 o'clock, after 7, 8 o'clock, that's a peak hour and your internet might not work well. But this will not be the case with Intel Vision's Truly Unlimited.
What was the reason for the delays?
The reason for the delays was some technical issues. During the initial laying of the cable, there was some minor issues that happened, so we had to arrange for a repair ship to come and actually resolve those issues to make sure that everything was working perfectly before going live.
Okay. And how was your internet being provided before?
So the internet was being provided before in two different methods. One is on the existing SEAS cable, as well as satellite capacity. We still have the existing SEAS cable so that we have a backup in case of any issues that happen in the future. We will still have or maintain the existing capacity.
Okay. Is it all of your internet packages that have been switched to this new cable or just these ones that are on the paper here?
Yeah, those are all the packages. All the packages, yes. If it was 20 GB, it's now 40. If it is 80, it's 160. 160 is 320. So we have doubled all the quotas because we have increased the speed. So when the speed is high, so the quota tends to finish faster. So that's the reason behind increasing the speed. And we also hope that customers has to keep in mind that your speed is a bit more faster now. So you have to mind what you're doing. But we also have tools for that. So customers can go onto our IKEA website, 4 times that speed. Okay, so pricing remains pretty much the same, but there are a few cheaper packages as well, but average pricing remains the same, but much more value for money.
I believe it's about 5 times the
5 times the speed.
Value of money.
Yeah, from what it was before. Right now we are concentrating mostly on the internet itself. So eventually we will move into the TV, which we'll announce at a later time.
The packages are basically rebranding of the existing packages. So the Crimson package is now the Infinity 899. So customers will automatically be converted from the old packages to the new packages. So they automatically get the benefit.
Dans News Extra tantôt, nous postons plus le clip l'obésité l'école primaire persévérance. Sa nouveau clip qui lancé la fin semaine passée pour amener message et organise une activité détente pour aider et épargner les enfants contre l'obésité qui devient un gros concern parmi les enfants aussi bien que parmi les adultes dans la société. Ce clip est un partenariat entre l'école et son conseiller.
Obesity has become a big concern for the youth of today's generation. Not only the youth, but public in general. So it is a medical condition in which an individual gains excessive body fat. So this chronic health condition occurs when the intake of calories by an individual is higher than the calories burnt out. In obesity, body fat accumulates to such an extent that it negatively impacts an individual's health. Obesity is a rising concern for the youth and young adults of today's generation. So it is a long-term health condition in which the body fat leaps beyond normalcy. Symptoms like more consumption of food than body requirement shows sign of obesity. So the rapid and alarming rise in obesity has led to accelerated death rate and unfavorable health condition among people. Obesity can lead to premature death as well. So sedentary way of living, indulging in alcohol, junk food, various types of medication are some of the factors that lead to obesity. Consumption of a high amount of energy, especially fats and sugars, without any activities to burn out the energy that causes the surplus energy to get deposited as fat. Obesity can sometimes occur due to genetic trait as well. A family suffering from obesity having a large appetite can cause offspring to inherit the same habit, leading to obesity. So obesity is a significant health concern and it needs to be prioritized. Prevention of obesity revolves around health eating habits, maintaining diets, physical activities, and proper medication. So thus, it is vital to take serious measures to stop the drastic spreading of obesity. Therefore, proper awareness and education programs regarding obesity should be carried out to make people aware of the fact that this dreadful phenomenon is preventable. Healthy eating, a healthy lifestyle from a very young age is the only way to curb this health problem. We hope that through this sensitization activity, programs, and emphasis that the school is putting on this issue will motivate us all to take action to live a healthy lifestyle. So blessed day to you all. God bless you.
My name is Faith. I am ready to fight. My name is Tanisha. I am ready to fight.
Awesome.
My name is Larry.
Good job. You're ready to fight?
Yes.
Awesome.
My name is Hannah and I'm ready to fight.
Awesome.
My name is Neil. I'm ready to fight.
Good job.
On déclare sa clip ouvert. Thank you.
Enjoy, have fun. Pas faire quelque chose sérieux qui nous peut pas impression, qui nous peut imaginer ah moi besoin faire ça. Just enjoy throughout. Mais il y a différents éléments qui viennent avec. Nous faisons des mesurements grandeur, grosseur pour nous regarder sa BMI et nous besoin regarder progrès. At least tous les mois nous connaissons manger quelque société à part qui nous peut faire une éducation pour manger et l'éducation pour manger nous mène dans la cour tout. Il n'est pas facile et après, nous devons faire nos exercices et nos différentes activités. Nettoyer dehors, planter et une activité. Enjoy everything you do, then you'll be fine.
Sa proposition, tu commences depuis côté de la santé. Il commence avec la santé. Côté la santé, il commence, même le président, il commence à marcher avec le chef exécutif de la santé. Et nous saisissons l'opportunité aussi, nous aussi, pour nous faire un clip à cause nous connaissons et nous voir il y a l'alarme. Et nous avons envie de passer un message, il commence depuis d'enfant. So, nous avons besoin de faire et why not today?
Il n'y a aucun club qui peut faire pour adultes, soit nous pouvons causer au niveau des enfants.
Pour le moment, les teachers, il y a des activités que nous faisons aussi. Et nous, l'école aussi, nous sommes capables de dire, nous ouvrons avec Kilo Game. So, tous les. On dit après l'école pour les municipaux peuvent travailler pour la guerre obésité. So, nous ouvrons pour ça. Il y a un Kilo Game qui vient ici, il y a un teacher qui fait ça pour les autres, la bonne enfants.
Peut-être un petit message qui ont envie de passer avec les enfants qui peuvent sentir autres un petit peu peur, effrayé pour être capable de booster devant. D'autres connaissent peut-être d'autres en ont un petit problème d'obésité, mais c'est mon connaît parler nos enfants nous calmer. So quel petit message qui ont envie de passer avec les autres comme si pour capable aider les autres un petit guide.
Message qui m'a pour les enfants. D'abord, on peut causer avec parents. Qui parents Yahweh. Nous pas dire ben nos enfants égaux, pareil nous content dire pas exister ça. Mais il y a des gens nous voit qui obésité, il y en a qui ont fait avec génétique. Nous pas qu'à montrer les doigts au manger ou manger. Yes, manger ou manger, mais seulement les enfants ils devaient jouer plus. So on nous pas faire ça vient curriculum dans les sens pareil, ou peut apprendre mathématiques non. Par il y a grand santé, il santé côté les enfants pour jouer. Nous avons construit quelque chose de tout le temps nous besoin imaginer côté les enfants pour jouer et ça pour aider dans son développement. Côté il peut jouer, il peut transpirer, toutes les autres questions encore. Mais again, pour parents, awareness, qui nous mange, quoi qui nous pas manger, quoi qui nous boit, quoi qui nous pas boire. Mais, venez l'exemple. Pas dire aux enfants faire, seulement ou pas faire. C'est la message qui m'en
Sacho, c'est nous dernier sujet de sa News Extra. Merci pour suivre. Au revoir et jusqu'à la prochaine fois.